Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Hana Atiqah, NPM H1A020059. I'm from Medical Faculty of Bengkulu University. I want to show and explain to you an article about how long do nosocomial pathogens persist on inanimate surfaces. In this article, I will explain 5 points of discussion: background, aims, methods, results, and conclusion. Background and aims. Inanimate surfaces have often been described as the source for outbreaks of nosocomial infection. There is an ongoing controversy about the appropriate treatment of inanimate surfaces in hospital in order to prevent transmission of nosocomial pathogens within an institution. Based on a lack of epidemiological data that will provide evidence of a benefit for the patient from surface disinfection, some scientists postulate that cleaning of surfaces with non-antimicrobial detergents is generally sufficient. Others prefer cleaning of surfaces with antimicrobial agents based on data on the risk of infection due to microbial contamination and potential transmission of nosocomial pathogens, at least in the immediate vicinity of patients. New guidelines on treatment of surface in hospital take into account more parameters which are considered to be relevant for preventing the transmission of nosocomial pathogens, such as the type of ward or the expected frequency of hand contact with a surface. Aims. The aim of this review is to summarize data on the persistence of different nosocomial pathogens on inanimate surfaces. Result. In the result, there are 4 points: persistence of bacteria, persistence of fungi, persistence of virus, and persistence of other nosocomial pathogens. Persistence of bacteria. Most gram-positive bacteria and gram-negative species survive for months on dry surfaces. Most gram-positive bacteria, such as Staphylococcus or Streptococcus, survive for months on dry surfaces. Many gram-negative species, such as Escherichia coli, Shigella, can also survive for months. And persistence of fungi. Candida albicans, as the most important nosocomial fungal pathogens, can survive up to 4 months on surfaces. Persistence of other yeast was described to be similar or shorter. The presence of serum or albumin, a low temperature, and high humidity have been described as leading to longer persistence. Persistence of virus. Virus can persist on surfaces for a few days even more. Most virus from the respiratory tract, such as corona, can persist on surfaces for a few days. Virus from the gastrointestinal tract, such as polio, can persist for approximately 2 months. Persistence of other nosocomial pathogens. Cryptosporidium species have been reported to survive on dry surfaces for only 2 hours. We can conclude that the role of surface disinfection for the control of nosocomial pathogens has been a contentious issue for some time. A routine treatment of clean floors with various types of surface disinfectants has been described to have no significant impact on the incidence of nosocomial infections. Disinfection of surface in the immediate environment of patients, however, has been described to reduce acquisition of nosocomial pathogens. Conclusion. There are 2 points of the conclusion. There are most nosocomial pathogens can persist on inanimate surfaces for weeks or even months. The review support current guidelines which recommend a disinfection of surfaces in specific patient care areas in order to reduce the risk of transmission of nosocomial pathogens from inanimate surfaces to susceptible patients. Okay, I think that's all. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.